record so that we can share this afterward, and it'll be uploaded to YouTube, it sounds like. So thanks to everybody for having me today remotely. I know, again, it's kind of odd to have a presentation like this remotely. So my name's Hannah Nichols. I may know some of you, I may or may not. I'm with the Civic Canopy, and we're a community-based nonprofit located in Denver. To provide a little bit of background, so we work to transform the way pivotal and important issues are solved in our society by creating a culture of collaboration across Colorado. So we're a community-based nonprofit located in East Denver, and we're working, primarily our work is to equip organizations, individuals, collaborative groups with the tools they need to tackle those complex issues and work together effectively. So we do that through a community-based learning model that's research-based that you see on the right side there. We do that through building connections, through shared technology, building capacity through training and technical assistance, like these types of events and trainings, and building a movement through engagement and advocacy, so supporting partners who are working together to build movements and support change by bringing different diverse voices to the conversation. And so most of my work here at the Civic Canopy supports stewarding and network stewardship around the Early Childhood Colorado Partnership. Many of you are hopefully members if you aren't already, and that's a statewide network that we'll talk a little bit about later as kind of a case study of collective impact. But in terms of what we want to cover today, hopefully leave understanding why some of our biggest cultural and social issues cannot be tackled by one individual agency or sector alone. Hopefully you feel like you gain clarity on the basic premise and history of collective impact as an approach to collaborative processes. And hopefully you feel like you have access to more tools and resources to learn more about collective impact after this and collaboration for social change. So, and I want to confirm, do I have until 4 p.m., including kind of discussion and questions?
Yes.
Okay, great. Sorry, I just wanted to confirm and make sure I don't go over time. So, we live in a very complex world, as you all know. The problems that we are taking on together really no longer lend themselves to simple solutions. And if they did, we really wouldn't all be here today scratching our heads about what to do with them. So we love this quote from Lawrence J. Peter, that some problems are so complex that you need to be highly intelligent and well-informed just to be undecided about them. And in the divisive world we live in, that feels more and more true every day. And so when we think about problem types in the big picture way of thinking, we kind of look at it from simple, complicated to complex. So if you're thinking about something like a healthcare kind of issue as an example we like to use, a broken arm or a broken wrist is a simple problem. We know, the definition of the problem is clear. The bone is broken. It takes an X-ray to figure that out. The solution is clear, that you need a cast. The kind of challenge it takes to get there is technical. You put a cast on the arm. Over time, it heals. You can get to more complicated problems that might be, replacing a heart and open heart surgery, which, again, the definition of the problem is clear, or it might be implementing a new policy in a hospital system. The definition of that solution might be unclear. We have to figure out how we get there. There might be multiple approaches you take to get there. The kind of challenge might be technical, but also needs to change over time and be adaptive. But again, totally solvable without bringing large groups of people together. Complex problems are, thinking about tackling obesity in a society, or in a community, or in a neighborhood. Even the definition of the problem might be completely unclear to those involved. So there's work to do to get people on the right page. The definition of the solution, you might have a myriad of solutions to get there in tackling an issue like obesity and healthy eating in a community. And the kind of challenge is definitely adaptive. There are lots of ways to go about solving that problem. It takes continuous, adjustment, measurement of how you're doing, and kind of adherence to these shared outcomes in order to figure that out. So we'd like to use a matrix here that's a kind of a useful way of thinking about those problem types and how it connects to this idea of collective impact as an approach to solving these big, hairy social problems. So this problem type comes from Ralph Stacey, a famed organizational psychologist who was fascinated by the question of what made organizations effective. And he noticed through his research that really what made organizations successful had less to do with their strategic plans and how we typically responded to problems, whether we be direct service or more systems level type organizations, and even more that their success really varied based on the types of problems that they were addressing. So the matrix that you see relates to really two key factors. So whether a group is close to, you see on the center of the axis here, or far from uncertainty as to what it would actually take to solve any given problem. That's what you see kind of on the bottom side. And also how close or far they are to agreeing on what strategy or strategies it takes to solve that problem together. So in cases where agreement and certainty are high, we call this a simple problem. So you can plan, control, use best practices to tackle it and solve it with, again, not a great degree of needing to leverage large groups of partners, figuring out a shared agenda, determining what your outcomes are. Pretty simple to tackle. And so when we move to areas where we're more close to agreement on doing something about the problem, but just not how to solve it, this is more of a technically complicated solution. So my slides got a little funky here. Hold on. There we go. It skipped a little bit. So thinking of getting to the moon, for example, there's lots of agreements on the importance of that. If you think back to 1968 when we sent somebody to the moon, there was just really no clear way to actually accomplish that goal. So they found the most technically competent people they could find. They gave them lots of support, lots of funding, lots of high levels of accountability. So even though we knew what needed to happen, it was just the technical complications of how do we actually get there. And then you get to socially complicated problems, which really involve more political processes, creating common ground. So these are more socially complicated problems where there's agreement on the actual nature of the problem. So you might have low graduation rates would be an example, or low birth weights, or maternal child health problems, something like that. But differences as to how to actually tackle it and what to do about it. So if you're thinking about the issue of low graduation rates in a county, it might be, the debate of charters versus neighborhood schools versus putting funding here versus putting funding there. These are socially complicated problems, and one resolved ultimately through political means, negotiated agreements, and consensus building. In some ways, these are the types of problems that can lend themselves to a little more of kind of a collective impact approach. But again, if there's agreement on even the problem and where you're starting from, tends to be more just of the socially complicated type. And then we enter what we like to call the zone of complexity. So complex problems really lack both a clear definition and clear solution. So they fit outside of these kind of bubbles here, so to speak. And so they require adaptive approaches because the process and outcomes are much more complicated. There's no clear cause and effect that everybody can get on the same page about. They often include values and beliefs and need to evolve based on what works and doesn't work that are really inherently tied to emotions and that kind of thing. The answer might not be known, and even if it was, it couldn't be addressed by one individual or group alone, or even a sector alone. And this is a lot of the work in early childhood that we're thinking about, and I know that Alliance for Kids is thinking about how do we work across sectors. It's not something that just the early learning or the healthcare or public health sector can tackle alone. These are big, complicated problems. addressing obesity in a community, addressing early childhood poverty, understanding the differences between these complex, complicated systems is becoming important for many aspects of management and policy. And with complicated problems or issues, one can kind of define the problem and strategically develop actions, timeframes, milestones along that path to success that you're seeing. And when it comes to more complex adaptive systems, that cause and effect are really difficult to predict. And so this is where the Canopy really does our work in supporting groups who are in this area, trying to figure out whether they've already done some work to identify some sort of common agenda and do some definition of the problem, and are just trying to figure out where to go from there, or whether you're starting at totally square one in an organization or in a community that maybe is suddenly experiencing massive migration rates, as an example of places where we worked in Prowers County. Issues like that, or a statewide issue around paid family leave, or just strong early childhood development, which is a lot of the work we all do. So this is kind of where the canopy sweet spot is in this zone of complexity, so to speak. So back in 2011, for those who are totally unfamiliar with collective impact, was a framework that really came about back in 2011. So for those we are lovers of the Stanford Social Innovation Review here. They have amazing stuff on all kinds of social impact and social change type work. So this article came out in 2011 by Kanya and Kramer, and it spread like wildfire. It really hit a nerve with a lot of folks who felt like they were doing this kind of work, and suddenly many people were just elated to finally have guardrails or a framework from which to work, and some were also like, well, we've been doing this work forever. You're just creating something out of something we've been doing for a long time. For those who might be working on toxic stress, I know we had the same reaction when the science around toxic stress came out around the same time, actually, the collective impact came out. It was, this is work we've been doing for so long, and finally there is a language and taxonomy and more of guardrails, I guess, around which we can work together. So at the Civic Canopy, we were doing this work around collaborative efforts, and we got forwarded this email so many times of like, I think this is what you guys have been working on and what you've been talking about. And so kind of started this big process of the Canopy taking on a lot more concrete role in this collective impact space. And so the kind of instruction manual, so to speak, as it was in terms of this first iteration of collective impact, part of today is really highlighting how it has evolved over time, and it really has, even since 2011, since it first kind of emerged. But at its foundation, that initial kind of article publication highlighted these 5 conditions of collective impact that can help organizations working in that zone of complexity, or collaboratives, whatever it might be, communities working in that zone of complexity. What were these foundational elements that were needed in order to be successful? So first was, a common agenda that everybody has a shared vision for change, including a common understanding of the problem and approach to solving it. So in the early childhood world, many of us adhere to the Early Childhood Colorado framework as a common agenda, at least in a broad sense of our kind of true north, our shared agenda. Shared measurement being how we collect data, measuring results consistently across all participants, ensuring alignment, and that we can hold each other accountable. And that looks different across different initiatives, and I'll highlight a case study of that a little bit later as it pertains to the Early Childhood Colorado Partnership. Mutually reinforcing activities, so activities that are differentiated while still being coordinated and supported through reinforcing plans of action. So this is the one that is it's pretty technically complicated and the hardest to achieve in my mind and in our mind, but it happens, and it's beautiful when it does. Continuous ongoing communication, and that's not just ensuring that newsletters get sent out, but ensuring that there are feedback loops, open communication, and opportunity for the voices at the table to be heard, that everybody who plays a role in that issue can be heard and share their voice. And then backbone support, which is largely what the Canopy, the role we played for a long time, is creating and managing these efforts supporting them to get off the ground with coordination, stewardship, supporting action teams, and I'll kind of highlight how that has played out as we go. But its core kind of definition and background, collective impact is really a commitment of a group of important actors from diverse backgrounds, sectors, to a common agenda for solving a specific complex social problem at scale. And the term specific is one of those that's been very subjective and lends itself to discussion more than we can do today around how specific does that focus need to be to really achieve collective impact. I know that in our example that we'll highlight, the Early Childhood Corridor Partnership, the mission is really around building a stronger system of support for children and families, not directed at a specific issue or problem, and that creates both opportunities and challenges. Whereas it might be different if somebody's tackling, again, like the example I threw out before was, in Prowers County, they were suddenly experiencing issues with massive migration rates in and out of their community, and so that was a kind of specific yet complex problem that they could tackle as a community. So these are problems that no single organization or sector can create and create solutions for at large scales and do it alone. So we've seen collective impact projects across all types of issues all around the world, whether it be education, health, homelessness, poverty, community development, climate change. I could go on. So this is kind of a great example of and a useful way to visualize the difference between collective impact and how we kind of typically have approached in our kind of typical approach, and how it differs from isolated impact. So frequently, you think of each arrow here, I guess, as an organization if you think about it. Or a group contribution. Frequently, we all feel like we're, at the bottom here, possibly working against each other, or at the very least, moving in different directions, or maybe our goals are in different directions. With intention and commitment, groups can move and align their efforts towards shared goals. So kind of the middle one that we see, where there's more coordinated action, still on separate paths perhaps, but again, moving in the similar direction. And as we think of, trying to click here, there we go. The arrows got a little funky on my formatting on my slide, so I apologize. So if they take the next big leap, often we'd hope to see an explicit shared agenda, more rigorous and strategic learning and accountability, that consistent continuous quality improvement, looking back at adjusting as we go. You'd hopefully see this more, everybody moving in step with a deeper impact. So this was back in, I believe it's 2014, was when we saw kind of collective impact 2.0, if you will. That initial framework provided this great foundation, and yet there were groups that felt like, it feels like it's just this formula that theoretically you're supposed to plug in these great 5 conditions. I kind of go back here, we plug these things in, and suddenly out pops collective impact and massive social change. Well, obviously, these are just 5 key foundations. There are other things that go into play. So as we learned over time, FSG, which is a national organization that does a massive amount of research on collective impact and support of collective impact initiatives, kind of brought out this layer to add on top of the kind of foundations of collective impact, these mindset shifts that we have to think about in addition to those 5 kind of foundational elements that we, and I won't go too deep into this in the interest of moving on, but you can see we have to move from technical solutions to problems to really being adaptive, and that's how it's evolved over time. I think people automatically, our brains work until we plug this in and it comes out the other side, but you have to actually consistently revisit, adapt, adjust. It has to, relationships, the second one here, and trust are huge as it pertains to these things. You can't just bring everybody to the table and plug those things in and hope things turn out well. You have to build those trusts, the relationships, getting the right people at the table, ensuring that credit isn't hoarded. I love that. That's a funny term to me, but that we see credit as shared currency that can be shared across organizations and entities. Even so, it felt also like this just came out in 2016, the kind of 3.0 version of collective impact. And I will admit, as a backbone organization, in some ways it felt like, oh my gosh, we just mastered this first piece and now you're adding more layers on it. I know for many backbones in Colorado, there has been that kind of sense of, oh my gosh, we just are trying to manage getting those 5 foundational pieces and you keep adding layers. But the truth is, these layers do add so much value in making collective impact kind of work. So moving from this kind of management paradigm from this, at the very core, at the very basic of how we've typically worked in the past, these very specialized agendas, to a more common agenda, which is one of those foundational things, moving to shared measurement and more aligned work, independent activities where we're all just doing our own thing, to those mutually reinforcing activities we talked about, the sporadic communication to continuous, unsupported to the having a backbone, supporting your role, and then adding this other layer of more of a movement building paradigm. And this whole concept of movement building and how you build movements out of collective impact has been huge. And Tamarack Institute is the group that kind of added this third layer on and helped us really understand a little bit more of, especially as a backbone entity, how to move from being an organization that just helps support these things to get off the ground to really being a container for community change. And hopefully you'll see more about how that actually plays out when I go through a kind of case study in a moment here. But these other layers added so much for us, and I think the authentic community engagement one was another piece where we just felt like, okay, you get all these people to the table, and then if you don't have those with lived experience, for example, if you're talking about healthy eating, active living in a community, but you have funders and nonprofits at the table and not anybody living in that community, then you're not going to achieve collective impact. So it's truly getting all of those voices at the table. So this is outlined in a resource that I can send in follow-up items in a more much more concrete way through a publication kind of format that can really help think about collective impact in a bigger way that we've applied very much in our community here at the Civic Canopy and in our work. So that was like the super quick overview of collective impact. I realized in a lot of cases we would end up doing like a half day. We have half day, full day kind of trainings on collective impact and how it works. This is just the kind of super high level highlight of how it works, but this just gives you kind of a quick rundown of what we went through very quickly, and hopefully we're going to walk through a case study in a moment here that hopefully makes it a little more real. But I do want to pause there and kind of, if there are any really pressing questions or things you want to revisit before we jump into the case study side of things and how it applies to an early childhood level. Is there any questions or comments? Great. So I'm wondering, and if I would always do a show of hands, but maybe I can do it through the phone and have it translated, of how many in the room, or what percentage to what degree are people in the room familiar with the Early Childhood Colorado Partnership? Do we have mostly new people?
Mostly new.
Mostly new, great. So the Early Childhood Colorado Partnership is a statewide network of individuals, organizations, agencies, actively implementing strategies to move the needle on outcomes within the Early Childhood Colorado Framework. Alliance for Kids is one of the most active members of the partnership at this time. And so really the purpose and mission of the group is to offer the space and conditions for diverse cross-sector, so across early care and education, mental, physical, behavioral health, family support like child welfare, essentially anybody and everybody who sees themselves within the vision of the Early Childhood Colorado Framework that all Colorado children are valued, healthy, and thriving would be welcome in this network. To identify common results, share best practices, and implement strategies to improve our system of serving children and families and their well-being. And so we are statewide. We're inclusive, open, welcoming to all who want to participate. And a key core principle is that we believe no agency can do it all. That's a key premise as to why the partnership was created, is that it felt like in order to maximize our shared impact, it took that kind of collective impact approach, if you will. So the partnership adopted a collective impact approach kind of formally in 2013. This was shortly after the original Early Childhood Colorado Framework emerged, and also after the collective impact framework emerged. At that time, the network identified the Civic Canopy as the kind of backbone organization for the network. The network had received a federal grant to support engaging and promoting conversations around the science of toxic stress and mitigating, preventing stress, and promoting resilience. So it was really, at the time, again, the science was spilling out, and partners across the state were like, what do we do with this, and how do we communicate it, and how do we take action on it? So it was really, the focus was broad within the framework, but it was also at that time focused pretty heavily on building an understanding of toxic stress, as that was a really, toxic stress provided a really central place where anybody, everybody in the early childhood field across sectors could see themselves and played a role in some way. So the shared agenda, if you go back to those 5 kind of foundational principles of collective impact for the partnership, at its core is the framework. And so when we look at our data-driven results, all of that, our foundation is the results of the framework at the child, family, environment, and state systems level. So as I kind of mentioned earlier, the framework is still really broad. And so to ensure that we're driving results on an ongoing basis, the partnership also uses an annual or biannual action map. So you see those results from the framework at the core at the top. And then we, in 2011, launched, or in 2013, sorry, when the partnership came to the Civic Canopy with the backbone organization being the Civic Canopy, launched action teams. At one point, we had 6 action teams. I'll kind of highlight a little bit about how that worked or didn't work later. But at this point, we support 2 action teams around shared messaging. So one of the key areas that the network statewide felt like there was a gap that needed to be filled was around how we communicate the importance of early childhood development and well-being, or communicate the importance of mitigating toxic stress. So that's been a key activity for the partnership. Data is also a very key activity for the partnership, starting at the population level. So how do we as a system in Colorado adhere to a set of shared indicators that are at the population level, so child and family level, systems level as well, because we all work within the system. So we have a data agenda that the data action team supports, and Alliance for Kids was the first group to take that data agenda and align your local level data, and is really the exemplar and standard for others who are starting to pick it up as well. So it's extremely exciting, and that's been a big area of progress. So we use this action map to kind of track our activities on an annual or biannual basis. The steering committee also uses it to track its work, and then also some of the other activities of the partnership. So we have this kind of broad agenda that we adhere to, that many adhere to across the state at the organizational level as well. And then the network itself tracks its own activities via this action map. And then the shared measurement piece, as I kind of already alluded to, the data-driven nature of it is that in order to achieve collective impact, we need to ensure we're tracking results and have our true North Stars in order to get there. So we've used the data agenda to drive that continuous quality improvement since 2013, and the data action team, of which again Alliance for Kids has been a part of for a while now, has has been the group to track that progress and apply it to the network's efforts. And that data action team is largely made up of data owners at various state agencies, so the Department of Human Services, the Department of Public Health and Environment, Healthcare Policy and Financing, and the Department of Education. Those data owners are all at that table for that data action team, and they see value in their work to be a part of this shared group that identified a set of indicators within our agenda, the Early Childhood Colorado Framework. All the indicators align with this agenda, and then indicators that can be disaggregated at the local level so that communities can also pick it up and use it and align it to their local work. So you kind of see how when all the members of the system kind of adhere to this shared agenda, shared data, it's kind of, it provides this, I like to use the term North Star for us to adhere to. Even though we know there's lots of other data out there, this group did their job of culling through over 100 indicators to identify, I think it's 17 that fit within the framework that we felt like we could kind of hang our hats on. So they're in the process of supporting partners to use this data agenda, and like I said, Alliance for Kids was the first one to use it. Continuous communication and ongoing communication, and kind of lessons that were learned over time for the partnership. So the partnership had a newsletter along with in 2011, 2013. The Colorado was very lucky to receive a lot of systems building funding to support various activities across our system. And so that also kind of meant that we had multiple newsletters being sent out from many different entities. I know at one time I counted I was receiving 8 different early childhood newsletters just at the state level. That didn't include any, council or kind of local level ones that make sense to exist separately. But we realized there were these systems building entities in Colorado that were sharing the same information across, 6 to 8 different newsletters every month, and filling everybody's inbox. And so that group got together and created what hopefully you all receive now, if not soon, our Voice newsletter, which is a monthly e-newsletter that really is a shared newsletter. The partnership through the Civic Canopy does coordinate that newsletter, but when you look at the branding of the newsletter, it's within the framework. No one organization or entity owns it. Everybody contributes to it. It's truly a shared process, and it ensures that ongoing communication and kind of that just shared accountability. In addition, it's network events highlighting network expertise and lifting up the talent and expertise of those within the network, and creating these feedback loops where action teams can build, provide feedback to them between themselves, the steering committee, and down, through local level, all the way up to groups like the ECLC, the Early Childhood Leadership Commission. And so those are the toughest pieces to build, but we've made progress, I think, in Colorado in doing that. In terms of some of the mutually reinforcing activities, which, as I alluded to before, is the toughest piece to achieve, I feel like. The shared message bank, which Alliance for Kids has also kind of used and adopted in some ways, is the perfect example of that, where so many partners within the network were considering taking on communications campaigns around different types of issues, spending different dollars, possibly having messages that not only didn't align, but maybe worked against each other. And it was via the umbrella of the partnership that we were able to say, what if we pooled funding together and created a shared songbook? So we're not all saying the same exact thing, but again, aligned in our message. And so it created this amazing movement, which has turned into the shared message bank that lives online, and everybody can use those messages. Different partners have contributed to it in different ways. We were almost done with it, and Project Launch said, oh, we want messaging around early childhood mental health, and they said, here's some funding, let's put those messages on the message bank, and then we'll run and use them as we need to. And so it was this beautiful example of, again, not everybody saying the same thing and marching like soldiers, but doing their thing in this beautiful, like singing from the same songbook is the term I like to use. So, and it's been amazing to see how groups have used it, and I can already see how we're communicating in a much more cohesive way in Colorado about young children. And then the Our Voice newsletter and data efforts really serve as these ways where partners might adapt that data agenda to their work in different ways, but again, using these kind of shared set of indicators helps us keep accountability to similar stuff, outcomes for children and families at the population level. So Alliance for Kids is taking it and adapting it to your local level data, child and family level data, and I know a group like ABCD, Assuring Better Health and Development, is taking it and really using it to inform their evaluation. So it looks different for every organization, but again, this shared kind of goal and North Star to look to. I know we just have a few minutes left, so I think we're on time here. Backbone infrastructure is a piece where the Civic Canopy being a backbone organization throughout history, we have learned eons and eons and adapted and changed our approach to this over time. And I think the partnership, the ECCP, was a perfect example of how we learned a lot about over-reliance on a single organization like the Civic Canopy and the unintended impacts it can have. Back in 2013, there were two of us at the Canopy who were mostly full-time working on the partnership and getting where it made sense to do so. It was that the network was just trying to get off the ground in a new iteration at that time, launching action teams or work groups, engaging in a lot of shared learning around toxic stress and early adversity for young children. And by 2016, we realized, oh my gosh, we're close to 3 to 4 full-time staff on this network. We realized not only are we having 3 to full-time staff on one single network, we also had we were running most of the action team meetings. We were developing agendas, and it was like, this is not collective impact. And I think a lot of backbones have learned this the hard way of how do you ensure, if you're running a network like this where you want it, the ownership, the process to be truly collective, how do you ensure the network owns that and it all doesn't live within a backbone organization like ourselves? And so we did a lot of, we've kind of overhauled our business plan in so many ways at the Civic Canopy to think about more that we are a steward for this network, and figuring out which action teams made the most sense to be owned and driven and connected most deeply to the work of the members at play, and which ones were more felt like the extra meetings that didn't really make sense, that you were just kind of volunteering to contribute to. And so right now we're at about one full-time person or total across about 2 or 3 people here. Seeing a much more, the pendulum kind of swinging back toward the action teams being led, owned by people who have expertise, who are deeply connected to that work, encouraging that ownership across the network, using events to leverage network expertise versus somebody like me saying, I think we should do an event on early childhood mental health. It's really organic. How can we make it organic and build from the foundations of the network, and then adjusting over time and saying, okay, at this time, last year, the steering committee needed some support, some extra facilitation and support from the Canopy with our unique tools to engage in a sustainability conversation. So we helped do that. And so you can see how these things might adjust over time, but those are kind of lessons learned for us as backbone infrastructure. And the partnership is certainly not the only case where that has happened. And we've also seen it on the other side, where a collective impact entity is maybe has a backbone entity to get them off the ground, and then the funding runs out and that network just fizzles and goes away because there is no support and there is no nobody who can ensure that the communication happens, that the coordination of meetings happen, and that the chairs are prepared and have their talking points, and that that events are being pulled and supported. And so We've also seen the pendulum swing too far to the other side as well. So it's finding that sweet spot that is based on the needs of that specific entity or collective impact entity, and the needs of that group at any given time. So I'll pause there for any kind of questions, things you want to hear a little bit more about or dig into a little deeper as it pertains to either the partnership or collective impact broadly.
Hannah, this is Jackie. Can you hear me?
Yes, I can.
Oh, great. We're just about running out of time, so we will open it up to the group. Any questions or comments, everybody, since she can't see you? Hannah, I think we're good, and we're just
okay.
I know we do need to close down, but thank you, Hannah.
No, thank you guys for letting me join. And again, sorry, it's always weird when I can't see all your faces, but yes, enjoy the rest of your meeting, and I'll be glad to send you a few things to send on to the group afterward.
Thank you so much.
Thanks.
Thank you.
Bye.
Bye.